The healthcare system in Canada is not always perfect. Mistakes are made, but Dr. Joshua Tepper believes it is critical we learn from past healthcare mistakes in order to improve the quality of services.
In the last few years, as we've talked more about quality and safety, we've gotten better at talking about the challenges we have with a one-on-one patient encounter. The challenge now is to start to figure out how to take those learnings at the individual level and share them.
He understands that it is hard to accept failure when a patient's well-being and even their life is on the line. He says politicians and health professionals are often too worried about losing the public's trust. He thinks the public would, in fact, be reassured to know that mistakes are being fixed.
People inevitably know, especially in this day and age, that things don't always go well. And we lose the opportunity then to maintain the trust by reassuring people that we recognize that this new approach didn't work, but we're committed to learning from it and to sharing that learning with others.
Professionals and politicians need to own up when an idea just doesn't work.
These are shared learning opportunities. And so I think that's part of actually building a culture of failure is moving away from the question of whose failure rather than what can we learn, what was our collective opportunity to do better next time and to improve what we're doing.
Nearly 12% of the GDP is spent on healthcare in Canada, so admitting to defeat might sound like money wasted. But Dr. Tepper says that ignoring failure is just not effective.
And then there's obviously this sort of cost issues of not learning from our failures. And ultimately, is you can't improve quality if you can't talk about failures. And I think, people believe and want a high-quality system. The only way you can improve quality is, in some cases, by learning what's failed. If we only try to improve quality by focusing on success, we're really shortchanging ourselves.
The public also needs to be involved in the process. A patient's bad experience can be a great opportunity to better understand where things went wrong.
I'm a deep believer in patient engagement, and so I think it's really important for us to constantly be working in partnership with the patients, learning from their experiences, benefiting from their wisdom in doing the work of quality improvement, and that includes in failure. And so they need to be part of helping us understand what that looks like, helping us dissect why it happened, understanding their perspectives, just like we try to listen to what works well, right? This isn't all negative.
In the end, Dr. Tepper reminds the public that overall, the healthcare system is doing well, but that every chance to improve it should be grabbed.
Let us not lose sight that the vast majority of time in the thousands and thousands of interactions that happen every day in Ontario and across Canada, the quality of care is very, very good. There's a lot of success. But we need to, at the system level and at the front line, when those rare occasions of failure happen, take better learning from them.
For Evidence Network, I'm Mélanie Meloche-Holubowski.